everybody. So now that we have discussed the male and female reproductive system, we can move on to pregnancy and development. So obviously this would be the successful part of reproduction. So the sperm fertilizes the egg. What happens next? So that's what we shall be discussing at length in this lecture. This slide specifically is important to know. Know everything about this slide and the definitions therein. You might be asked to match the term with the definition, or you might be given the definition and asked, which of those is the term. Anyways, know this slide. Pregnancy is what happens from the time of fertilization until the infant is born. The conceptus is what we call the developing offspring. So from the time the sperm and the egg fuse, which is called a zygote. So a zygote is the fusion of the egg and sperm. The conceptus is everything from that zygote until the baby is born. And it can be the conceptus, the developing offspring, it can be at any point of the pregnancy. So from the zygote to the birth at any point therein, it's the conceptus. The gestation period is from the last menstrual period until birth, so it's a little bit different. It's actually longer than the conceptus, right? It's going to be a few weeks longer than the zygote to birth time. And then the embryo is a conceptus from fertilization until week 8. And then the fetus is a conceptus from week 9 to birth. But all of it, other than the gestation period, is the conceptus, right? Because the gestation period is going to be the time from the last menstrual period until the birth of the baby. So the gestation period is just a little bit longer. And then the pregnancy is what happens from the fertilization until the birth. Everything that goes on therein. So know these 5 terms. Here is a picture of relative amount of growth over 12 weeks. So notice at week 3 the embryo forms. At week 5, still an embryo. Still probably don't know you're pregnant at week 5, even though you're growing from 3 millimeters to 10 millimeters. Week 8 is usually when women notice that they might be pregnant, especially if they weren't trying to get pregnant. And then at week 12, or 3 months, the first trimester, if you will, you'll notice this big developmental jump. So this is the 12-week fetus, and it's at 90 millimeters. You can see the big jump from fertilization, embryo to 12-week fetus. From egg to zygote, the oocyte or egg cell or egg is viable for about 12 to 24 hours, whereas sperm is viable for 24 to 48 hours after post-ejaculation. So it's a really narrow window of time for sperm to get to the egg before the egg dies. Write this down, okay? You'll have to know this. In order for fertilization to occur, sexual intercourse has to happen no more than 2 days before ovulation at the earliest, and then no later than 24 hours after ovulation at the latest. So that's why some folks that have a hard time getting pregnant chart their ovulation periods. So 2 days before ovulation at the earliest to 24 hours after ovulation at the latest. That's the window of time. 2 days before up to 24 hours after. Now some women that don't have a regular period, that aren't very regular, with their periods, they may not be too sure exactly when ovulation is happening, and they could get pregnant by accident. So if you're not trying for a baby, use contraception. Because irregular periods could have irregular ovulations, right? Makes sense. And then definition for fertilization, it's when the sperm and egg fuse and make a zygote. So that's for fertilization. Some obstacles that can occur for fertilization. We already talked about a couple of these: an acidic vaginal environment, a really, really tightly closed cervix, specifically, or some sperm obstacles would be specifically to get to the correct fallopian tube. So only one ovulates at a time, right? So the sperm has to choose correctly, and only a few hundred to 1,000 make it that far. Another obstacle could be uterine phagocytes. So there are white blood cells trying to eat the invading sperm. And then the sperm, they have to be swimmers, they have to be modal, they have to move, which we already discussed, right? If they're not swimming, they'll never make it. And then they have to be capacitated by female secretions that weaken the acrosome membranes. Remember, the acrosome is in the head of the sperm, and it has enzymes that help penetrate the egg. So the sperm has to penetrate the egg and has to bind with the covering, and has to release enough enzyme from the acrosome to digest that covering. It has to undergo the acrosome cortex reaction. So big calcium surge there. And it has to have ZIP enzymes to eliminate all other competitor sperms, so only one sperm can fertilize the egg. Monospermy, that's what that means. It means only one sperm fertilizes the egg. That's the definition. Then, after all of that, the sperm head must fall off and separate from the midpiece. And then finally, the sperm head and the oocyte, the egg cell, fuse together. They form a zygote, and that's fertilization. The fusion of those two. So those are some steps. And that is everything that I just talked about happening in this picture. So you can look through those. You can look through those little pictures. If all of that doesn't happen, then there's not going to be a pregnancy. If you guys like step-by-step pictures, here it is really, really specifically. You won't have to know what this is specifically, but you can read through it and everything. So step 1, aided by surface hyaluronidase enzymes, the sperm cell weaves its way past the granulosa cells of the corona radiata, right? So you can read through all of that. Step 1. Step 2, binding. Step 3, acrosome enzymes digest through that covering. Step 4, sperm forms an acrosomal process which binds to the egg's sperm binding receptors. Step 5, sperm and oocyte plasma membranes fuse, allowing sperm contents to enter the oocyte. And then step 6, entry of the sperm contents cause a rise in calcium levels in the egg cell cytoplasm, triggers a cortical reaction. And then the result is a hardening of the zona pellucida and clipping off of sperm receptors. Slow block to polyspermy. So again, monospermy, one sperm fertilizes one egg. One sperm fertilizes the rest of them die, right? And then, that head got clipped off. The rest of the sperm body. Anyways, those are all the steps of everything that was just written down that I just talked about. So, breaching the covering all the way to the sperm head and the egg cell fusing. That's what that's talking about. All right, moving on. So we just made a zygote, right? We just made a zygote. We just had fertilization. The sperm fertilized the egg, made a zygote, fertilization happened. Now we have a developing embryo. So immediately the fertilized egg begins moving towards the uterus. This all happened in the fallopian tube, not the uterus, so it's called a zygote at this point anyways. We're now moving toward the uterus, which takes a couple days. You'll see a picture of all of this in a second. That's going to make it make sense a little bit more, but we're just going to talk about it right now. So the fertilized egg splits. It goes through mitosis. Days 1 to 2, we have our first cleavage, which gives us 2 daughter cells called blastomeres, little ball of cells. Day 3, we have division, which gives us a morula, which is a ball of blastomeres, up to 16 cells in this ball, in this morula. At day 3 to 4, we have a blastocyst. We're at about 100 cells now, and it's a hollow little ball. And by day 3 to 4 is when we reach the uterus as well. So we're in the uterus. So if this fertilized egg implants before it gets to the uterus, so we call it an ectopic pregnancy. So your fallopian tubes, they can't support a pregnancy. It's dangerous. If it grows, it can cause mother to bleed to death, right? We've all heard of ectopic pregnancies. They aren't going to come to term. But that's what happens if a fertilized egg implants in the fallopian tube before it gets to the uterus. So there's that. A blastocyst, it's a hollowed out fluid-filled sphere. A trophoblast cell, they participate in placental formation. So that's where the placenta begins to grow. That's the mom side of the placenta. And then inner cell mass, that's the embryo side of the placenta. Okay. So sperm swim upstream, bloop, 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 up, 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 until they hit an oocyte, an egg. They fertilize the egg, they form a zygote. Boom, zygote. A zygote goes down, 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 A, B, C, D. And then we get to E, where the blastocyst implants. Here is an up-close picture of the blastocyst with a trophoblast cells on the outside and the inner cell mass on the inside. So the trophoblast cells, remember that's the mom side. Inner mass cells is the baby side. So up closer, where you can see here where the trophoblast cells are attaching to the uterine cells, epithelium, uterine lining. Here's the baby side, inner cell mass, and that's the mom side, trophoblast. Anyways, day 4 to 5, the blastocyst floats around. Day 6 to 12, implantation begins. And the endometrial cells you just saw in the previous picture cover the implanted blastocyst. Literally, the blastocyst burrows into the uterine wall. Now, if you get a period around day 4 to 5 where the blastocyst is just floating around, there is a possibility that you can shed the blastocyst out before you even know that you got fertilized, right? Day 4 to 5, there's no way for you to know that fertilization occurred, or, you know, that there's a blastocyst floating around waiting for implanting into the uterine lining, right? So if you get a period here, no pregnancy. You flush it out. But anyways, day 6 to 12, implantation begins. Implanted blastocyst covered by endometrial cells literally grows over the blastocyst. Blastocyst is burrowed in there. At this point, enzymes are released to keep the endometrium from shedding. So no period, right? But if that implantation hasn't happened yet and you do get your period a little bit early, then there's not going to be a pregnancy. You're going to flush that blastocyst out with your uterine shedding walls, endometrial walls shedding, period, menstruation, flushing, the floating blastocyst will flush out, implantation won't happen. But if we do get to day 6 to 12 where implantation does begin, then enzymes are released to keep that endometrium from shedding and not having a period to flush anything away. Okay. Anyways, during pregnancy, there are hormonal changes, believe it or not. What you need to know here is that the presence of HCG, human chorionic gonadotropin, that is what indicates pregnancy. So HCG indicates pregnancy. That means you're pregnant. That is what pregnancy tests are looking for. So it's secreted by those trophoblast cells, prompts the corpus luteum, remember that, to make estrogen and progesterone. We're about to talk about corpus luteum until I'm blue in the face. If this doesn't happen, then there's no pregnancy, no fertilization. HCG levels are going to get higher and higher until about week 8. The decline happens when the placenta takes over with the secretion of progesterone and estrogen, and we'll talk about that more when we talk about the placenta. If HCG goes down and progesterone and estrogen doesn't go up and the placenta isn't ready to take over with secretion of progesterone and estrogen, then you will have a miscarriage. So that's a little bit more detailed than our previous lecture in reproductive systems. So this is what that looks like on a graph. So 12 weeks, notice that, 3 months, that's your first trimester. If a miscarriage happens, it's usually here. And that's why a lot of people don't really announce a pregnancy until after the first trimester. So HCG goes down, estrogen, progesterones go up. Placental formation. There's an embryo side and a maternal side. So in embryonic tissues, cells develop from the inner cell mass and form the chorionic villi, which is the membrane outside the embryo. Now on the maternal side, the layer of endometrial cells, they're going to fill up with blood and start forming the blood flow for the baby. So know this. The placenta is fully formed and functional by month 4, and it starts secreting progesterone and estrogen. Relaxin, that's going to start a little bit later. And then maternal and embryonic blood supplies, they don't mix. The baby makes its own blood supply, which is a whole nother thing in and of itself that we're not really going to get into here in this lecture. Membranes outside the embryo, amnion. You guys have heard of amniotic fluid. The amnion is the sac filled with amniotic fluid. So be able to list the functions of amniotic fluid. So again, amnion, sac filled with amniotic fluid. It provides a buoyant environment, a constant temperature, and it provides freedom of movement and prevents parts from fusing together. So that is really, really important. And it's really, really important for the mom to stay hydrated so that there's enough fluid for the baby to float around in. If the mom's dehydrated and there's not enough fluid, that's going to cause problems for the baby because the baby needs a buoyant, fluid environment at a constant temperature to float around in, so that the parts that are developing don't fuse together. Let's see, amniotic fluid, that comes from maternal blood and then later fetal urine. Yummy. So stay hydrated, pregnant ladies. It's very important. Even if you have to urinate a million times a day, which we will also talk about. Another membrane outside the embryo is a yolk sac. So it hangs from the belly part of the embryo, and later, write this down, the yolk sac transforms into the digestive tract as the baby matures. The yolk sac is also the first place that a baby's blood cells and blood vessels start to form. So write that down. Forms part of the early digestive tract. The allantois is another membrane outside of the embryo. It's on the butt end of the yolk sac and forms the umbilical cord and later parts of the urinary bladder. The chorion, it helps form placenta and encloses the embryo and all other membranes. And then the chorion is going to be the outermost membrane. Gastrulation is a developmental process by which an embryo goes from a blastula to gastrula. So a blastula was a more one-dimensional embryonic disc, and a gastrula is more multidimensional with 3 distinct germ layers. We just talked about the allantois, the ectoderm, and we just talked about the allantois, the chorion, we talked about the yolk sac, the amnion. So now we're going to talk about the germ layers, ectoderm, mesoderm, endoderm, all of which we will hit at length. All these germ layers are going to give rise to our organ systems, connective tissues, nervous systems, et cetera, et cetera. And if you open up this PowerPoint, you can watch this video on YouTube that will kind of show you gastrulation and how the embryonic disc kind of turns into that ectoderm, mesoderm, endoderm layer. So the ectoderm specifically, neurulation is the formation of the nervous system. This is the first major event of making organs. So brain first, then spinal cord. Brain controls everything. The ectoderm forms over the notochord, which becomes the spinal cord, and forms the neural plate. The neural plate is going to fold in. Once it does, it's called the neural groove. And then it folds down the center and creates neural folds. So something to note a little bit later is that a spinal column is not the end result of this, just the brain and the spinal cord, but not necessarily a spinal column. Anyways, the folds, they fuse into a neural tube, and then the anterior end will be the brain and the rest will be the spinal cord. Again, not the spinal column, but the spinal cord. Then we have neural crest cells, make the cranial, spinal, and sympathetic ganglia, and the adrenal medulla. And there's also a YouTube video of neurulation if you want to watch that. So this is a picture of that embryonic folding after neurulation. It's color-coded to show ectoderm as blue, the mesoderm as red, and the endoderm as yellow. And you can see how the folding happens. there. If you want to see a little bit more, you can watch this YouTube video and this YouTube video. Okay. So what happens after neuralization, specialization of endoderm? So embryonic folding begins with lateral folds. Then head and tail folds appear, and then you have the endoderm tube that forms the GI tract, and then the mouth and the anal openings open up, and the endoderm also gives rise to the respiratory tract and the throat. So specialization of endoderm, remember that's GI, that's respiratory, that's throat, that's mouth, that's anus. So GI tract from your mouth to your anus, and respiratory system, endoderm. So ectoderm is the outside, that's blue. Endoderm is the inside, that's yellow. And then mesoderm is going to be the middle, and that's everything else. So I know we haven't talked about mesoderm yet, but I want you to understand that if you learn what the ectoderm layer gives rise to and the endoderm layer give rise to, then you're going to know that the mesoderm is everything else. So that's why we talked about ectoderm and endoderm first, because the mesoderm is going to be everything else. So memorize ectoderm, epidermis, hair, nails, glands of skin, brain, spinal cord, and endoderm, digestive and respiratory tracts. And then you'll know that mesoderm is literally everything else. Notice that spinal column, the vertebrae, mesoderm, kidneys, gonads, connective tissues, the walls of the digestive and respiratory tracts, visceral serosa, heart, blood vessels, vertebral discs, myotome, trunk and limb musculature, dermis of the dorsal body region. So mesoderm is everything else. Endoderm is digestive and respiratory tracts. Ectoderm is brain, spinal cord, neural crest. Epidermis, hair, nails, glands of skin. Okay. So at 5 weeks, you can see all the organs kind of beginning to kind of start forming, kind of start basically at their step one, first steps into development, right? So now the mesoderm, so that's the red layer, the middle layer that we just saw and saw on the chart. It's also color-coded red. Mesoderm forms into 3 functional parts of little sections called somites. So the mesoderm separates out into chunks of that, which is going to become all those things that we just saw color-coded in red. And each somite has 3 parts. The sclerotome, so sclero is bony, the dermatome, derm is skin, and the myotome, myo, muscle. So if you have not taken medical terminology, taking medical terminology is going to help. If you know the base, you'll know exactly what it's talking about. So if you have not taken medical terminology, I really recommend it. Anyways, each somite has 3 parts: sclerotome, dermatome, myotome. So sclerotome cells, they're going to make the vertebrae and the ribs and the bony parts, right? Dermatome parts of the somites, they make the dermis, the skin on the dorsal part of the body. So the dermis of your back. Remember, the epidermis is the outside, it's the ectoderm. Mesoderm is the dermis layer. And then Myotome cells, they make skeletal muscles of the neck, trunk, and limbs. So these 40 sections of mesoderm are all called somites, and they each make up 3 parts, 3 functional parts. So know this slide, know everything about this slide. You're going to be asked to match the functional parts to their definitions. So again, here's a chart again with everything these germ layers give rise to. So again, if you can memorize the ectoderm, you can memorize the endoderm. You'll remember that all the rest of these are mesoderm, but know that the mesoderm is broken up into somites that each have 3 functional parts, and you will be asked to match these 3 functional parts to their definitions. Okay. Now let's move on to the development of fetal circulation. So we started with the nervous system. Now let's talk circulation. So the yolk sac is where the first blood cells arise. By the end of week 3, you have arteries and veins, and the vessels forming the heart have already fused to make a heart-like structure. So know that for the quiz. At week 3, vessels of the heart formed and fused. Know this slide. You'll be asked to match what bypasses the lungs or what bypasses the liver. So ductus venosus, liver, foramen ovale, and ductus arteriosus, lungs. So 3 vascular shunts close at birth. Anyway, there are 3 vascular shunts. These close at birth. One is the ductus venosus that bypasses the liver. So the umbilical vein forms the ductus venosus. Don't need the liver right now. You're not filtering blood yet, right? So this one is going to bypass that. Ductus venosus bypasses the liver. The foramen ovale, that is an opening between the atria of the heart. So the 2 top chambers of the heart bypass the ventricles, bypass pulmonary circulation, aka the lungs, because you don't need those yet. You don't need the lungs yet. You're floating around in amniotic fluid. So the foramen ovale bypass pulmonary circulation, bypass the lungs, and go straight to the body. And then the ductus arteriosus is also a bypass for the lungs. So if blood does get to the ventricles, the ductus arteriosus sends it straight to the aorta and out to the body. So it never goes to the lungs. So know that ductus venosus bypasses the liver, foramen ovale bypasses the lungs, and the ductus arteriosus also bypasses the lungs. The fetal period happens in weeks 9 through 38. So basically by this point, everything is in place. It just needs some growing time. By week 9, all the systems are there. They just need to mature. These next slides are going to tell you what to expect at certain weeks. So here, what to expect at week 8. Head nearly as large as body, all major brain regions present, first brainwaves, brainstem, blah, blah, blah. You can read through that if you want to. Weeks 9 to 12, what to expect. What to expect when you're expecting. That's a book and a movie now. Weeks 13 through 16, development events of fetal period, 17 through 20, month 5, and then month 6 and 7, and then months 8 and 9 with weeks 30 to 40. Good informative slides if you're curious. Now let's discuss some effects mom feels during her pregnancy. So several changes happen. Let's talk about some. The reproductive organs are going to become really, really engorged with blood. And these come with 3 signs. The first is the Chadwick sign. The vagina turns purple. The second, breasts are going to get bigger and the areola is going to darken. And then 3, sometimes there's something called chloasma, and that's pigmentation of facial skin. The moms that get it, most of the time it goes away, but sometimes it's going to stick around after pregnancy for a long time, unfortunately, in some women. Obviously, the uterus expands, takes up most of the abdominal cavity, and you get something called lordosis because of this. And that is a big scoop in your lower back. And that happens because the center of gravity is going to change when you're pregnant. You're going to have a big belly that's going to pull you forward. Lordosis happens to kind of get you pulling backward and regaining some sort of center of gravity. And that causes a big scoop in your lower back. But there's going to be weight gain around 28 pounds. That's really specific, so around 25 to 30 pounds. And then relaxin is a hormone that causes the pelvic ligaments in the pubic symphysis to relax so that your pelvis opens up when it's time to deliver the baby. This is a picture of the mother as she's developing through the pregnancy. Notice the word fundus again. So the fundus of the uterus is the topmost part, same as we learned in the stomach. So before conception, uterus is the size of a fist, resides in the pelvis. By month 4, fundus of the uterus is going to be halfway between the pubic symphysis and the umbilicus. By month 7, the fundus is going to be well above the umbilicus. And then by month 9, the fundus reaches all the way up to the xiphoid process. So just some anatomical changes. And then we just saw some anatomical changes in the expecting mother. So what about some physiological changes? So know what causes morning sickness, okay? The GI tract. So morning sickness is attributed to elevated levels of estrogen and progesterone. If you are asked what causes morning sickness, know that it is due to elevated levels of estrogen and progesterone. When pregnant, a baby pushes against the stomach, so it can force acid up your esophagus and give you acid reflux or heartburn. And then a baby also sits on your intestines, and that can cause some constipation because it's pushing against your intestines and cause some things not to flow very correctly, right? Whether going out of, intestinally or up through the GI tract. Up or down through the GI tract, I guess. Anyways, heartburn, constipation are common in pregnant ladies. Urinary system. As somebody who is pregnant is going to experience a lot more frequent urination. This is because there's an increase in urine production due to an increase in metabolism and fetal waste. And remember that progesterone is a diuretic, which also makes you urinate a lot more. Also, the baby is sitting on top of your bladder, so incontinence or urinating on oneself can occur. The respiratory system also changes too. Many females experience nasal congestion due to an increase in estrogen. Tidal volume increases, so the expecting mother is breathing in more deeply and more in general because you're trying to get oxygen for 2. Difficulty breathing can occur a little bit later, but not always. When the baby gets bigger, starts moving around, maybe starts kicking in the direction of your lungs. Cardiovascular system changes. Blood volume is going to increase by 25 to 40% because you got a whole placental circulation going now that you didn't have before. With an increase in blood volume, blood pressure and pulse also rise. And because you have a baby sitting in your abdomen, you may have impaired venous return if the baby is sitting on the blood vessels coming back up from the legs. That can also cause varicose veins that we've talked about, swollen feet, swollen ankles. If you see pregnant women laying on their left side, it's to take pressure off those vessels. And then we have labor. Let's get that baby out of there. Know that parturition is childbirth, labor, and delivery. You might get asked. Parturition is childbirth. Initiations of labor. So the last couple weeks of pregnancy, here's what's happening. The baby creates cortisol. Okay? So know what cortisol does. Know the functions. That stimulates the placenta to make more estrogen. Estrogen is your labor and delivery hormone. Estrogen causes the myometrium, so the myometrium is the smooth muscle tissue of the uterus, to produce oxytocin receptors. That antagonizes the nice calming effect of progesterone. Progesterone is your nice calm hormone. And then that leads to Braxton Hicks contractions in the uterus, which are preparation contractions. Basically, they're preparing your uterus for the big contractions that are going to happen. Know the 3 initiators of labor. 3 things that start labor and delivery. Know these 3 things. First, the baby's lungs are going to have surfactant protein A, so SPA, not SPA, but I guess you can remember it as SPA. SPA, surfactant protein A. That's the fluid that helps the alveoli in the lungs open up when they go to breathe air. Some preemie babies, they don't have that, and that's why you'll sometimes see premature babies on a ventilator. But anyway, surfactant, it causes the mom's cervix to also soften and start to open up to make way for the baby to come out. Second initiator of labor, fetal oxytocin causes the placenta to make prostaglandins. Prostaglandins are inflammatories, which is why you do not want to take any anti-inflammatories for labor pain. So you need inflammatories to initiate labor. If you take anti-inflammatories, you could actually stop labor. So that is not something that you want to take. Oxytocin and prostaglandins together are super strong uterine muscle stimulants, and the baby makes those. And that's why sometimes the saying goes, the baby's going to let you know when it's ready. See. Stages of labor. So here I want you to know that the longest stage of labor is the dilation stage. Okay? So you will be asked this, so know this, write it down. If it can take 6 to 12 hours or longer here at the dilation stage. The initial contractions that you start with are pretty weak. They're 15 to 30 minutes apart and about 10 to 30 seconds long, which means pretty far apart and quick. So some females that they eventually, they think that they actually have gas pains and not contractions at this point. But as time progresses, the contractions are going to get stronger and faster, and eventually those contractions will force the cervix to open up. And when the cervix, opens up fully at full dilation, we're at 10 centimeters. 10 centimeters is equivalent to your 4 fingers, not your thumb, side by side. And that is what is being measured, how open that cervix is at full dilation. And at full dilation, it is open 10 centimeters. And then the amnion will rupture, and that'll release amniotic fluid, like, oh my gosh, my water broke. That's what's happening. The amnion has ruptured, and it's released amniotic fluid. It can be a little bit or it can be a lot. It just depends on the woman, depends on the person, depends on how hydrated they are. And then engagement occurs. So that is where the head starts coming down into the pelvis. So head enters the true pelvis. But remember, dilation stage is the longest stage of labor. The expulsion stage. Let me get a drink of water. So the expulsion stage, strong contractions here, about 1 minute long every 2 to 3 minutes. The urge to push increases. Unless you have anesthesia, then the doctors are going to have to tell you to push, the doctors and the nurses, because you're not going to feel that same urge. Under anesthesia. Without anesthesia, you're going to feel an urge to push, and it's going to increase at this expulsion stage. Crowning is when the largest part of the head is visible to the outside. And then one shoulder should pop out. And then the other shoulder should pop out. And then the rest of the baby should just come right on out. You want that baby to crown. If not, doctors are going to try to get the baby to rotate. But sometimes an emergency C-section will result as the safest option, even though it sounds like, an emergency. It will result as the safest option if the baby does not want to cooperate and rotate. Sometimes these things are known ahead of time, and that's when doctors will schedule a C-section. Obviously, there's a lot more that goes into this, including high risk, etc. But we're only talking about crowning and what happens if baby isn't head first. Want that baby to be head first. Placental stage. So after delivering the baby, you gotta deliver the placenta too. So the strong contractions are gonna keep going. The placenta is gonna detach, and it's gonna compress the uterine blood vessels. This happens around 30 minutes after birth, and a baby suckling after being born also helps placental detachment as well. And it helps, that bonding between mother and baby also helps detach the placenta. But that further helps the uterus contract, push the placenta out, and close off the blood vessels so the mother doesn't bleed to death after having the baby. All placental fragments have to be out of there to prevent postpartum bleeding. So postpartum, after birthing the child, the baby bleed. Here is an image of the placenta detaching from the wall of the uterus. So you can see where the uterus is, you can see where the placenta is detaching, the umbilical cord coming out. Neonatal period. So adjusting to life outside the uterus. Outside the uterus, baby's adjustment to life. The neonatal period is 4 weeks long. Write that down. The physical status of the baby is assessed 1 to 5 minutes after birth. So breathing, healthy, this is what they're assessing. It's called an APGAR score. APGAR score is used to assess that baby's physical health with point indicators. So 0 points up to 2 points, with 10 total points to choose from. If your baby's 10 out of 10, that is a healthy baby. That is what we want. Any score that's less than 8 points is concerning. So APGAR, appearance, skin color. So 0 points if the baby's blue or pale. 1 point if there's a pink body and blue extremities. And then 2 points if the baby is completely pink. Pulse. So 0 points if it's absent. You want there to be a pulse. 1 point if the pulse is below 100 beats per minute. And 2 points if the pulse is over 100 beats per minute. So pulse rate's high, great. Baby just went through something stressful, right? It was in a liquid environment, and now it's not in a liquid environment. Grimace. So grimace is response activity. So you're looking at response reactivity, tickling the feet, spanking the bottom, prompt stimulation, prompt response to stimulation, 2 points. No response, 0 points. Minimal response, 1 point. Activity level, moving around. If there's no activity level, 0 points. If the baby's flexing its arms and legs, 1 point. If the baby is wriggling around, flexing arms, legs, wriggling, 2 points. That baby's used to, being in a fluid environment, so it should be moving around. Respiration. So a loud cry, 2 points. Slow and irregular cry, 1 point. No cry, 0 points. So APGAR score. Again, we want that APGAR score to be 10 out of 10. That's a happy baby, healthy baby. Less than 8, like I said, is concerning. So respiration, like we said, we want a loud cry. So first breath. So there is a lot of carbon dioxide buildup in babies. So respiratory acidosis stimulates or triggers that baby's first breath. So write that down. I want you to know that. Respiratory acidosis, high CO2 level, stimulates respiratory control centers to trigger the first inspiration. Respiratory acidosis triggers the baby's first breath. Think about if you get too much CO2 in your blood, what do we talk about? You gasp and you breathe deeply too to get more oxygen in there and to level that out. Babies take that first gasp to open up the alveoli, and surfactant helps. Babies breathe quickly for the first 2 weeks, around 45 breaths per minute for the first 2 weeks, and then that number kind of settles out. You're going to have to know this. The transitional period, so the first 6 to 8 hours after birth, has to be closely watched. This is the most unstable period for the baby directly after birth. So transitional period is the most unstable period, and it's 6 to 8 hours after the baby is born. It's in a whole new environment. If they're good for about a day after birth, then they're good to go. Babies are going to sleep a lot. They'll wake up when they're hungry, and they have a dirty diaper, when they're angry, and that'll kind of stabilize with time and waking periods occurring every 3 to 4 hours. But transitional period is the unstable period lasting 6 to 8 hours after birth. There are going to be alternating periods of activity and sleep. Vital signs may be irregular during that activity, and this is the most closely watched period of time after the baby is born. Lactation. So when nursing, the first liquid that comes out is not milk. It's called colostrum, and it's yellow. It's got a ton of vitamin A, ton of proteins, ton of immunoglobulin A, IgA antibodies. So that is on the quiz. IgA, immunoglobulin A antibodies that protect the baby from infection, and that's the baby's first immunity complex. So the colostrum provides the baby's first basic immune system, and that's released the first 2 to 3 days, and then it turns into true milk production. So that's why breastfeeding is so important. If you can't breastfeed, that's okay. You can buy colostrum. You can buy breast milk. Suckling also initiates a positive feedback loop and causes more milk to let down. Oxytocin, that help the mother with contractions of the uterus, also helps with milk letdown. For moms that don't have breast milk, they may also not have had any natural contractions and had to be induced to deliver the baby. So that's just a fun fact. Some advantages of breast milk: fats and irons are going to be more easily absorbed. Amino acids are going to be more easily metabolized with breast milk rather than anything supplemental. You should not give a baby's cow's milk. No, if you can't give a baby breast milk, you can't buy breast milk, then get something that is a good supplement for breast milk formula. Don't give a baby cow's milk. There are beneficial chemicals for immunity, like I just said, immunoglobulin A antibodies. There are complement proteins, lysozymes, interferons, lactoperoxidase, and then interleukins and prostaglandins are going to prevent, they're going to help keep inflammatories down, basically. Prevent overzealous inflammatory response, if you will. Okay, some more advantages. Breast milk's also a natural laxative, and it gets rid of meconium. So that's the first poop the baby has. If it's reabsorbed, it could cause jaundice. Breast milk also encourages bacterial colonization in the large intestine. So, like we talked about, promotes good bacteria. We talked about this in digestive. Good bacteria in the colon. Breast milk encourages that, which is good. That's what you want. Lastly, for those who have trouble getting pregnant, there are several assistive tech to help. One way is to surgically remove eggs after, the woman has taken hormones, fertilize those eggs, and then return that fertilized egg to the lady. Know the difference between ZIFT and GIFT. ZIFT is zygote intrafallopian transfer. That's when a fertilized egg gets transferred to the fallopian tube. And then we have GIFT, so gamete intrafallopian transfer. So a sperm and a harvested egg, whether it's your egg or someone else's, are transferred to the fallopian tube together, and it's basically letting nature take its course whether or not that sperm and that egg fuse to make a zygote. Whereas a ZIFT, that is a zygote getting put into a fallopian tube. There are so many different things and so much more information with pregnancy and development that I've barely even scratched the surface with this lecture, but I hope that you have at least a base understanding of what is going on with fertilization, pregnancy, development, and I hope you've learned something.